Turning now to the fight against COVID-19. Right now, the updated boosters have made their way into a lot of pharmacies here in Georgia, but a lot of people are even opposed to the flu shots, and some medical experts are concerned they will have that same attitude when it comes to those COVID boosters.
Yeah, 11 Alive's Jerry Carnes looks into how likely it is that people are actually going to get the bivalent booster.
3 shots down and Jamie Howard is ready for another. After suffering through one bout with COVID, she's prepared to roll up her sleeve every year. Some of her friends are not on the same page.
It's just part of life, like a flu shot. Now, most of my friends have gotten all the boosters so far. I think it's the continued part they're all a little anxious about.
The White House COVID response team says the era of multiple COVID shots each year should be behind us.
We want to get into the cadence and the rhythm of about once per year, get an annual shot.
Less than half of all Americans get their yearly flu shot. Desire for COVID shots seems to have flattened. 74% of America had at least one shot in the arm at the start of the year. 9 months later, it's 79%. Dr. Ashley Hannings of UGA's College of Pharmacy says many people have started to downplay the impact of COVID, much like they do each year with the flu.
I think my concern is kind of the changing attitude. I think public health officials are going to have to be very intentional with their messaging and communicate things very clearly if they want a strong uptake.
Dr. Hanning says health officials need to remind Americans of the chaos at the start of the COVID pandemic and the role vaccines played in getting us where we are now.
We are in a much better place than we were 2 years ago when everything hit. But we still have people who are ending up in the hospital or getting very sick. Best way to stop that from spreading is for more and more people to get vaccinated.
Jamie Howard is on board.
If it's got to happen every year, it's got to happen every year.
The coming months will reveal if the majority of Americans feel the same way.
Manufacturers were in the process of updating COVID boosters for one variant when they had to shift when BA4 and BA5 came along. Dr. Hanning says that experience will make it easier for manufacturers to adjust the vaccines if other variants come along.